Hello, I'm Shaina, and I am going to be talking to you about asthma. So, first things first, what is asthma? So, asthma is a chronic or long-term respiratory condition that affects the airways in the lungs. It is a condition in which someone's airways become inflamed, narrow, and swollen and produce extra mucus, which causes difficulty in breathing. So on this next slide, I have a picture of an asthmatic lung compared to a normal lung. You can see how the asthmatic lung, the airways are quite small because of swelling and excess mucus. So signs and symptoms and triggers. So signs and symptoms include shortness of breath, wheezing when exhaling, trouble sleeping caused by shortness of breath, coughing or wheezing attacks that worsen with a respiratory virus such as cold or flu, and then chest tightness or pain. Next, we have major triggers. So that includes airborne allergens, which would include pollen, dust mites, mold spores, and more. And then respiratory infection, which is mostly because of coughing or extra mucus production. Physical activity, I'll go over that more later. Cold air, again, because of coughing and possibly having shortness of breath. Air pollutants and irritants, any gases that you might breathe in, and also the airborne allergens we went over. Sulfites and preservatives. Many people with asthma can be affected by sulfites and other preservatives, and they can cause many of the symptoms, including wheezing, coughing, and shortness of breath. Medications. Many can be triggers depending on what is in them. Again, what preservatives they have can be huge. Strong emotions. This can include things like anxiety, stress, and even excitement. They can be triggers because of the change in your breathing patterns and also the inflammation of your airways. And the last one I'll go over is the gastroesophageal reflux disease, or GERD. This is when contents from your stomach, such as stomach acid, come back up into your esophagus and cause irritation. Next, we'll go over the different types of asthma. So firstly, occupational asthma. Occupational asthma, also known as work-related asthma, is caused by breathing in fumes, gases, dust, or other substances at work. These substances can change the way your lungs work from an immune system response. If you do not treat it or avoid triggers for occupational asthma, it can lead to permanent changes to the lungs. The next one is exercise-induced asthma. So exercise-induced asthma is when the airways narrow from hard physical activities. It causes things including shortness of breath, wheezing, and coughing during or after the exercise, and it's quite common in athletes. Most people with exercise-induced asthma continue to exercise and remain active with treatment. Treatments include different medicines like inhalers and taking steps to prevent symptoms before physical activity starts. So here I have a picture showing athletes with and without exercise-induced asthma. So on the left is with and on the right is without. So it's a lot more common for indoor sports players to have EIB, or exercise-induced bronchoconstriction, a lot more than outdoor sports. The last type of asthma is allergy-induced asthma, or allergic asthma. And it's a condition where your airways tighten when you breathe in allergens. These allergens are usually in the air and include dust mites, pollen, animal dander, and mold spores. Next, we'll go over the severity of asthma. So the lowest class is intermittent asthma. So asthma symptoms occur less than twice per week and short flare-ups. Symptoms do not affect daily activities. Symptoms at night are no more than twice per month. And FEV1, which is a test that measures the amount of air a person can forcefully exhale in the first second after taking a deep breath, is 80% or better. And then peak flow rate measures the speed of air exhaled. The rate varies by less than 20%. Next is mild persistent asthma. So asthma symptoms happen 3 to 6 times per week. The level of activity may be affected by flare-ups. Symptoms at night occur 3 to 4 times per month. FEV1 is 80% or better, and peak flow rate varies by less than 20%. The next one is moderate persistent asthma. So asthma symptoms are daily. The level of activity is somewhat affected by flare-ups and symptoms. Nighttime symptoms occur 5 or more times per month. The FEV1 is between 60 to 80%, so a little lower, and peak flow rate varies by more than 30%. Lastly is severe persistent asthma, and it is basically the same as moderate persistent, but I'm sure that all your symptoms would happen more often than the moderate. Lastly is treatment. So prevention and long-term control are really important for stopping asthma attacks before they start. Treatment usually involves recognizing what your triggers are and taking steps to avoid those triggers, and also controlling your breathing and making sure your medications are keeping symptoms under control. If you do experience an asthma flare-up, you might need to use an inhaler. Here are all my resources, and thank you for listening.